Hello. Today we will be discussing about a right decubitus for the chest and how to be able to position this on our patient. First, we will need to do our patient preparation. This includes introducing ourselves, stating that we are the ones going to take their images today, and ask the patient for their full name, date of birth, and last menstrual period if needed. The image receptor size for this image should be around 14 by 17. The image receptor orientation should be landscape, and the image receptor location is preferably the wall bookie, but can be done on the table bookie if needed. The SID for this image should be around 72 inches. Patient positioning should be where the patient is laying on their right side with both arms up above the head, knees slightly flexed, and the chin up to clear out the lung field. Our part position should include to place the image receptor in the wall bookie and to adjust the height of the image receptor to the thorax. The central ray location for this image should be leveled at T7 or 3 to 4 inches below the jugular notch. We will not need any angulation for this image at all. The collimation field size should be full collimation of the cassette, which should be 14 by 17. The visual appropriate marker location will be the left marker will be needed for this image and should be placed by the shoulder or within the shoulder anatomy. The kVp range for this image should be approximately 120 kVp. The instructions to the patient for this exposure will be to tell our patient that they need to hold very still and that we are going to expose on full expiration breathing, which means we need to tell our patient to take a big breath in, blow it all the way out, take another big breath in, and blow it all the way out and hold it. The anatomy demonstrated in this image should be the entire lungs, including the apices, both claustrophrenic angles, and both lateral borders of the ribs. The items in profile should include the diaphragm, the ribs, and the hard borders. The pathology best demonstrated or clinical indications for this image will be that the small pleural effusions are demonstrated by air fluid levels in the pleural space, and also that small amounts of air in the pleural cavity may demonstrate a possible pneumothorax. This is everything that we need to be able to set up our right decubitus chest for imaging our patients. Thank you.